speaking of injuries, oh goodness, and don't the Sharks have a lot of them at the moment? And I feel like the Sharks are being a little cagier actually with their injuries at the moment. So normally they're out with, the pilot medical update a little bit earlier, I thought, than they were usually. They put it out as late as they possibly could this week with the announcement of a whole bunch of injuries. So Francis will talk to you about each of these ones individually. So we've got Toby Rudolf with a possible syndesmosis on top of his other injuries from last year. And we wanted with 3 to 6 weeks. What was your take out on that one, mate?
Well, the syndesmosis is an ankle injury, and it's not a outside or inside ankle ligament. It's the ligament that holds the two bones together. There's a ligament at the front and the back of the ankle, and then there's a tissue between the shin bones, the tibia and the fibula. And at the bottom, when it splays apart, just imagine if you had an old style stretcher and you pulled the hands apart and the material split, that's a syndesmosis type injury. So it's spreading of the base of the ankle joint. So it goes in grade 1, which is mild and can be managed in 3 to 6 weeks with a boot, rest and tissue healing. Grade 2 is more severe and goes to 10 weeks healing. And if it's a grade 2 or grade 3 in a professional sportsman, they usually have the surgery. So the surgery is to pull the bones together and have 2 screws put across and hold them in place. Or these days, the more modern technique is to put a tie wire through, which is a better result, has physiological movement. The old screw method usually had to have the screws taken out 3 months later. So looks like with Toby, as far as we know, it looks like a lower grade high ankle sprain or a low grade separation. So it will actually heal in place. And that healing, it's about that 4 to 6 week period.
Are these injuries more common now than they used to be, the syndesmosis, or is it just
I think that the diagnostic ability is more accurate. We've got more specific tests for that injury, which can be done on the sideline very quickly. And then if it appears severe, or with all professional sportsmen, they'll be raced into the local radiologist and have the MRI and make a clear diagnosis of the level of injury.
Is the recovery time improved on a syndesmosis? Because I recall several years ago, if someone got a syndesmosis, it was like, oh, well, that's them now. They're done. Put a line through them. We'll talk about them in a couple of months. Seems to be a lot quicker now, a lot less severe.
I think the surgical techniques are a lot better, and they are allowed accelerated recovery with weight bearing and movement. So they still have to have that initial period in a boot and non-weight bearing for a few weeks, and then can accelerate pretty quickly. So it has shortened, but it's still a significant injury. Sorry, Chris.
We should have got Zach. We should have got Zach on here, my son, because he had that surgery himself, and he still doesn't trust his ankle 12 months on. But I keep telling him he's had the ankle put in, and he's done the work. Just relax, but he just still thinks it's. He goes to the gym and does those squats, but he doesn't trust the surgery that he's had. But I just tell him it's stronger than ever. They put an anchor in there, it's pretty good. It's pretty amazing. Surgery was done in a couple of hours and he was out, so it's pretty amazing.
I think that it is. It takes a lot of confidence. All these big operations on joints do take confidence out of the players, and there's a psychology of getting that confidence back. And progressive loading and getting back into that functional jumping and landing and pushing up off the ground and sprinting and stopping. And with your son, perhaps he needs to get a little bit more up and go in those functional things to get his confidence. But they are challenging.
Shame he doesn't live around the corner from you anymore, Francis. Otherwise, we'd send him to you and you'd sort him out, unfortunately. Sorry, Zach, you stuck down in Wollongong, mate. Let's talk about. Look, Chris, you were there. Did you actually see Royce Hunt actually warm up and then go back to the bench, Chris? Did you see that?
No, because as you guys saw on the group chat, I thought that he must have done it in the warm-up, not actually warming up on the sideline. So I thought he did it in the warm-up, and that's where I thought the replacement comes in, because I've seen teams, guys go down in the warm-up and all of a sudden they're rushing and they've got to get approval to get the 18th man in. So I was a little bit confused, like, where is Hunt? What's going on? And just thought we're going to get, Ero's going to come into the team and we've got an 18th man. But, God, like I said, the Tigers come out roaring and all of a sudden we're already one man down as well. So it was just
we can't get any minutes from him. Francis, what happens in a warm-up if someone does a calf? Look, obviously you're not there and you can't diagnose it by any means, but you can speculate for us.
Yeah, muscle tears in the warm-up usually occur. The hamstring and the calf are most common. And usually players have either had some post-training soreness or perhaps a mild knock in the game or training through the week, but not significant enough to, cause them to, seek treatment or pull out, but can be a weakness in the calf with rapid acceleration and quick stopping, which we do, players do on the sideline in preparation for, the game situation. That can sometimes fail. It's not common, but it does happen occasionally. So, yeah.
He'll be doing a whole bunch of calf stretches this week, won't he, Francis?
Yeah, well, they're predicting 3 to 4 weeks, so it's a bit like Cleary with his hamstring, low grade, 4 weeks out, and in that time, a lot of rehab, a lot of stretching, a lot of strengthening, and the last week, should be pushing to be 100%.
Yeah, fair enough. All right, well, that's Royce Hunt. And then Amanueli, we're expecting he might be a chance to get back this week. He's got that recurring knee problem. He hasn't been named.
So
no, I haven't seen him anywhere.
So
I still think you're right in that.
If you're not named, you can't come back. But it's probably a case where he could have come back, but with the bye, they sort of said, let's give him an extra week off, which gives him technically 2.
Yeah. Yeah, I'm in the dark a little bit with Hamulin's.
It's no word on him, is there?
Sure.
Yeah, no word on him at all. And then Dale Finucane has got, he got? The fractured eye socket.
Yeah, so the eye socket fractures, again, can vary in degree. They can have a period of rest and healing, 2 to 3 weeks if they're very minor. If they're anything more than minor or slightly out of a line or what we call displaced, sometimes we'll put, a little bar and a couple of screws to hold it together, and that can come out later on after 6 or 7 weeks. But according to all reports, it'll be 3 weeks of rest and recovery, and you should be able to start back with training and light contact, then full contact. Yeah. That's what I would expect.
You mentioned training there, Francis. An injury like that, is it just impact that you're worried about, or could you do sprint training or marathon training, gym sessions unaffected?
Yeah, Franco, there'll be a lot of cross training. The first sort of 72 hours, 2 or 3 days, let the swelling and inflammation settle down, and then it'll be back to cross training. A lot of low impact cardio training, moderate to strong leg weights and upper body weights. But just back off the chance of getting another knock on it. Yeah,
gotcha.
They can push pretty hard actually. Yeah.
And then we've still got Cade Dykes and Jesse Colquhoun floating around. So the Sharks have got what? 1, 2, 3, 4, 5, 6. Yeah, 6 of the top 20 players injured. It's not ideal, is it?
No. Well, we talked about Cade Dykes' hamstring a couple of weeks ago, so he should be looking. I would hope, we haven't seen him named anywhere, but he should be looking to be training at close to 100% this week and back next week. And then the metatarsal, which is the 4th long bone of the foot. It doesn't look like that's been surgically repaired, so it's going to be like any fracture, 6 weeks to repair and a few weeks to get back on his feet and running. Yeah, so he's not back in the near future. Yeah.
All right. Well, that was the.
That's as much as I know. Yeah.
Well, it's pretty bloody knowledgeable, mate. I got to say, that's a lot better than I would have made up.